Good afternoon parents, I am Dr. Abhishek Bhattacharya and I am pediatric dentist from Mumbai, and today I will be discussing on the topic whether to go for a pulpectomy or a root canal therapy or an extraction in your kids' milk teeth. Now whenever you go to a dentist or to a pediatric dentist and they see that a cavity is too big, they usually recommend either to go for a root canal therapy with a cap or an extraction with a space maintainer. Now in this case the dilemma is which one do you wish to go for? Now the condition is, let's take one at a time. Now coming to root canal therapy. Now whenever we as a pediatric dentist or a general dentist suggest you to go for a root canal therapy or a pulpectomy with a crown, that means the child is too young and the milk tooth has some time to fall on its own because the permanent tooth is yet to come out. Now for example, the black teeth, they fall off on its own at the age of 10 to 12 years of age. Now if the child is say 5 years old, then obviously the pediatric dentist or the general dentist will suggest you to go for a root canal and a crown unless the tooth is grossly decayed and it can't be savable. So in that scenario, I would suggest better go for a root canal or a pulpectomy and place a cap. But if the child is 5-year-old and the tooth is completely destroyed and it cannot be saved, then in that case it's better to go for a extraction, that is tooth removal, and placing a space maintainer to help it maintain the space after removing the milk tooth. Now in this case, let us know how different the two treatments are. In a root canal therapy or a pulpectomy, you may have to visit the dentist at least 2 to 3 times depending on the cooperation of the child if you are planning to do on a dental chair. Whereas in an extraction and a space maintainer, usually done in 1 or maximum 2 to 3 sittings depending on if you're giving the work, if the doctor is giving the space maintainer work to a lab technology. Now when you're doing this therapy in a general anesthesia, in a hospital or in the sedation technique, then there is a possibility that the dentist or the PI dentist may do more sections of the teeth in one sittings. In that case, the number of sittings will decrease. So whether you're going for a single sitting or a sedative technique, then the number of appointments might decrease considerably if you're going, or if you're compared to if you're going for a normal sitting on a dental chair where you might take at least 2 to 3 sittings per tooth. Based on that, you can decide which one suits best for you in terms of time factor and in terms of economics. In terms of economics, I would rather say it's almost the same, because in both the cases, time and material and the lab techniques are always incorporated in both the techniques. So I would suggest personally, if you ask me, root canal and placing a cap is the best treatment plan for all kids' milk teeth if the child is too young. If at all, unfortunately, the tooth is very decayed, then yes, you definitely might go for an extraction, but definitely go for place a space maintainer immediately after removing the milk tooth to maintain the space for the new teeth to come in a proper alignment. So if you have any doubts, or if you have your child going for a root canal therapy or in space maintainer, and if you have any doubts regarding that, do let me know in the comment section or click on the link below.